My name is Wang. I'm a senior hospital scientist from SydPath, St. Vincent Hospital, Sydney. I'm delighted to have the opportunity to present our work on evaluation of Oncomine Comprehensive Assay V3 using Genexus System and sharing our early experience of Oncomine Comprehensive Assay Plus. Here is a standard disclaimer from Thermo Fisher. So many cancer panels have been carefully developed and designed based on the data learned from comprehensive studies. Laboratories worldwide are implementing those targeted panels to identify cancer genomic variants and ultimately try to improve patient outcome. As NGS employed a broad plate of technologies and tools, and standardizations have been limited, so therefore regulatory bodies have to develop policies and procedures to outline the practice requirement. And in Australia, National Pathology Accreditation Advisory Council, or called M.Med, which is managed by Australian Government Department of Health and Aging, is the main regulatory bodies. M.Med released the guidelines and set up regulatory framework and quality assurance program for NGS-based tests. So NGS guidelines cover every step that lab needs to achieve when introduce NGS. That include ethic issues, personal training, scope of test, laboratory procedures, IT infrastructure, informatics, QC, and QA, and requesting and reporting. But today I'm going to discuss the evaluation work covering laboratory procedures, informatics, QC, and QA. So in NGS lab, the evaluation procedure must include end-to-end workflow. The entire procedure has to be evaluated and documented. All equipment and reagent must be specified during the evaluation. For OCA-V3 evaluation in our lab, DNA extraction is performed by King-Fisher dual prime purification system using McMax FFPE DNA and RNA Ultra Kit. Entire NGS workflow was performed by Genexus integrated sequencer using Oncomine Comprehensive Assay V3 and GX5 chip. The bioinformatics analysis used integrated Genexus software 6.2, which include predefined filter chains such as Oncomine variant 5.16 and Oncomine extended 5.16. We further use Oncomine reporter 5.0 for further variant classifications for reporting. So it's important to note that if any changes in the workflow, lab must carry out additional evaluation tests to ensure assay accuracy according to the regulations. So let's look at the OCA-V3. The OCA-V3 covers 161 cancer-associated genes, and this targeted NGS assay enables the detection of relevant SNVs, indels, copy numbers, and gene fusions. Good quality specimen is essential for NGS testing, and in our lab, tissue assessment is performed by qualified anatomical pathologists, and only specimens less than 12 months old were used for the assay. Pathologists need to confirm the tumor types and assess the tumor content. The minimum tumor content for SNV and indel detection is 10%, while 30% or more is necessary for reliable copy number variation evaluation. Microdissection may need if tumor content fails to reach the minimum requirement, and pathologists need to mark the area of interest. So FFP tissue was used for DNA extraction, and DNA extracted or quantified by qubit. 25 microliter of DNA is required for OCA-V3 with minimum DNA concentration of 1.11 nanogram per microliter, and for RNA is 0.95 nanogram per microliter. Extraction blank and non-complete controls have to be included in every single round. So total 83 specimens were enrolled in the evaluations. They include reference standard, cell lines, and 16 different tumor types with no mutation profile. The specimen type including surgically resected tissues, cell blocks, biopsy tissues, and small slides. This covers most of our routine sample type and tissue types. Total 14 separate machine runs were performed during the OCAV3 evaluation process. And our experience with the Genexus system is a very fast setup. They use pre-filled reagents that help to reduce hands-on time, and single instrument handling setup to report workflow. So they prevent use error by using onboard vision system to verify reagent placement and detect errors in real time. And they use established ion current and ion amplification technologies enable consistent results throughout the workflow. It's a full automatic process, so that significantly reduces the labor cost and human errors. The system automates the library preparation, templating, sequencing, primary data analysis, and variant reporting. And the progress can be monitored online in real time. And for OCAV3 panels, up to 6 specimens can be tested in a single run. It will take about less than 24 hours from DNA template to the completion of the sequencing. So first, let's look at OCAV3 and Genexus performance across 14 runs. The average loading is 91%, and average reads per lane can reach 15.8 million, ranging from 14.7 to 16.8 million. And this exceeded the 12 to 15 million reads per lane claimed by the company for Genexus chip. In addition, enrichment and library are both more than 99%. The final read is between 40 to 60% after excluding polyclonal and the low-quality reads. The panel also have control fragments for internal control purpose. The control fragments show consistently over 20,000 reads per lane with over 98% base call accuracy. And these metrics indicate templating success. No contamination was observed in DNA, RNA, and GC from all 14 instrument runs. In conclusions, there is excellent machine performance measured by key parameters across 14 runs. So after proof the machine performance stability, we carry out the test to examine the intra and inter-assay variations. Reference standard HD789 together with 2 specimens were tested in duplications in the same run to examine the intra-assay variations. And those samples were also tested across 2 to 3 separate NGS runs to check inter-assay variation. So total of 8 duplication tests were performed. The quality parameters of the intra-assay specimen test show high reproducibility within duplicated tests in both reference standard and samples. Very comparable results were observed in the key quality parameters such as percentage on target, mean depth, and uniformity in duplicate tests are all very, very similar. Similarly, between assay variation across the different runs are also in a very satisfactory range. The untargeted read percentage were all over 90%, and the depth of coverage of all samples reached above 1,000 times. The average uniformity was almost 94%. And let's look at the mutations. 57 out of 58 SNV and indels were consistently detected in both intra and inter-assay testing. The only missing SNVs is a mutation present at 3.5% in the reference standard. And all 6 fusion and 6 copy number variations were consistently identified in the intra and inter-assay comparison. The inter-assay precision test was also measured by comparing key run parameters across 14 separate instrument runs. Sequencing performance revealed high consistent run quality. We also assessed inter-operator components by comparing run performance between 2 lab operators using same protocols. And there's no difference in run quality between the 2 operators across the 14 separate runs. For analytical sensitivity, 3 categories of variant were used. Category 1 contained SNVs, MNVs, and indels, and category 2 is for CNV, and category 3 is gene fusion. All 83 samples were selected for sensitivity analysis, and for category 1, 97% sensitivity was achieved in SNV and 100% in MNV and in indels. The 3 missing variants would all have low variant error frequency of less than 5%, which is below our intended test limitation. The overall sensitivity for copy number variations is 86.4%. The OCLV3 called gene amplification in 19 out of 20 specimens with gene amplifications. The 3 gene amplification was not called by OCLV3. All have copy number increase of less than 5. The OCLV3 can detect increasing copy number, but will not consider this as a gene amplifications. All 23 inter- and intra-gene fusion events was correctly detected, and all gene fusion was detected for more than 500 reads, and all sample exceeded RNA read of more than 1 million. For analytical specificity, again, 3 categories of variants were used for evaluate the specificity, and at least 815 shared hotspot variants between cancer hotspot V2 panel and OCLV3 were included in the calculation of specificity for SNVs and indels. The specificity for this category is almost 100%. No false positive variant was detected in overlapping hotspot variants when variant error frequency present at more than 5%. And similarly, both CNV and gene fusions reach 100% specificity. Quality parameters of 83 specimens were very satisfactory. 81 of 83 reached a mean read depth of more than 1,000, and 82 of 83 have on-target coverage of more than 90%. The uniformity of all samples of more than 85%, with large majority of more than 90%. So assessment of low limit of detection was performed by repeat sequencing of reference standard HD789 contain variant between 3.5 to 4.5%. The HD789 carry 5 mutations, including SNVs, insertion and deletions, and 2 of the 3 SNVs even have high GC content. So 5 repeat tests reveal that 96% sensitivity of OCLV3 in the detection of variant with variant error frequency between 3.5 to 4.5%. So in conclusion here, the Genexus automatic library preparations, templating preparation, sequencing, primary data analysis, and variant reporting, they significantly reduce human errors. They deliver up to 6 tests in 1 day with a single touch point and 5 minutes of hands-on time. The very reliable machine performance and satisfactory sensitivity and specificity in SNV, indel, copy number variation, and fusion detection. The detection limitation for SNV and indels is 5% of variant error frequency, and for CNVs, OCLV3 can detect the gene application when copy number reach more than 5 copies. There's some improvement is required. So the benchmark pipeline needs some improvement. For example, the standardizations of HGVS nomenclature, especially in the deletion and duplication name, and the need correctly display exon numbers in the antisense transfer. I believe the new version of system, which will release very soon, will fix all these issues. We're also very pleased to have the opportunity to experience the OCL Plus. The OCL Plus for Genexus System has been recently developed. It contains more than 13,000 amplicons and covering more than 500 genes. The assay is designed to discover SNV, indel, copy number variation, and fusion. They use new GX7 chip and hope to achieve 20 to 25 million reads per lane. Up to 4 samples can be run in each GX7 chip with 20 nanograms of DNA and RNA input. The pre-treatment of FFP sample DNA with UGG has become a standard process in its workflow. It takes about 25 to 26 hours from DNA to RNA template to the completion of sequencing. So we have conducted 6 runs with GX7 chip. Very similar to OCA-V3, the machine performance is excellent across 6 runs, which is demonstrated by the loading, enrichment, library, final reads, and row rate accuracy. The GX7 chip delivers more than 95 million reads in the whole chip, which the chip is now designed for about 80 million to 100 million for the whole chip. So all our samples tested can reach a satisfactory coverage, the coverage of between 1,000 to 2,000 with very good uniformities. The average uniformity is 96%, ranging from 94 to 97%. It's excellent concordant in SNV and indel detections. Cross-comparison of mutation profile of 15 cases between Oncomine Precision Assay and OCA Plus show identical results. They also have excellent concordance in microsatellite instability measures. We have 12 cases with mismatch repair deficiency detected by IHC. 11 cases show the MSI high, and 1 case did not show because the QC failed. So in the preliminary conclusion here, its automatic system reduce manual steps and facilitate quality data and quick report. The OCA Plus can deliver up to 6 test runs and only require 20 nanogram of DNA and RNA input. It is a consistent machine performance. It is satisfactory sequencing coverage and uniformity. And this panel can measure SNV, indel, copy number, gene fusion, as well as the tumor mutation burden and microsatellite instability. We're looking forward for the official release of OCA Plus in 2023. Thank you for your attention. Thank you.